What is up with the quality of this video? I look absolutely terrible. Well, you're going to have to stick with it with this bad quality for now. It is the same day leading on from, well, it's only been maybe not even a couple of hours since I published my last video when I was having a really bad, not really bad, but the pain of migraine in my head, in my brain. Thanks for my speech isn't going. This is not related to migraine, but thanks to the medication and the guy who, there is one person who discovered that this helps people with migraine. I actually want to meet him. There is a YouTube video. Maybe if you simply just, oh God, I hate the quality of this, but please bear with me. If you just do a search with the YouTube bar, like a YouTube search for, I don't really know, something like who discovered sumatriptan, and you'll maybe find that guy. Tell him I sent you and how grateful we all are that this medication works. I highly doubt it would, like, he would have his own YouTube channel, but anyway, the after effects are, oh, just so you know, this bad quality is not only for when I am not feeling well. This is just me using an old phone. I prefer to use it instead of using my tablet because, like, it's so many things I can do with that, and I'm so easily distracted, so I'd rather just use this phone. What was my point? Yes, that's it. That the side effects that I have from the medication called sumatriptan, SUMATRIPTAN, it's like summa, or Japanese or something, suma, not sumo, suma, triptan, like a summer trip, you can get a tan, which is kind of what I look like in this video right now. My skin's not really that colour, picking out all my freckles, as it's summer now, sunny out there, sunny outside. The side effects. I personally have nausea and wind, as it's called, like you can feel a massive fart brewing, and I have the stomach pain, but once that air is dispelled out of your arsehole, I feel a lot better. I'm not saying you should fart around me and I'll feel better. Well, I probably will, because I'm bound to laugh. For some people, when they have a migraine attack, vomiting makes you feel a lot better. It does for me, but I tend to not vomit as much as I used to. I mean, like, naturally I don't force it, but even if you make yourself vomit by putting your fingers down your throat, as people say, it does relieve pressure somehow, and you feel a massive pressure release, a relief of pressure from your brain. I don't know how that works, but that isn't a thing that I personally do. I wouldn't suggest doing it. People can be desperate because of the pain in their brain just to vomit, and it gives you some kind of relief, but only in an extreme form of migraine attack where you cannot get relief from the pain. And I am fully aware of various types of migraine. Anyway, I'm going to shut up now. I'm going to run out of storage on this phone again. Thanks for watching. I'm going to take me time and do stuff with my bike. You will see me soon. In much better lighting as well. This really aggravated or agitated me, but also made me laugh.
What the traditional thought is on migraine headaches, I want to show you. It's thought to be what's called a vascular headache. And what you see is a blood vessel here. When it expands, it actually is thought to send pain signals to the nerves that line these blood vessels, which cause the symptoms of a migraine. Throbbing pain, often on one side of your head. Nausea, sometimes with vomiting. People sometimes have a sensitivity to light and noises. But a new, and some say extreme procedure is offering relief for migraine sufferers just like Stacy. We have Dr. Baman Gairan from the University Hospitals of Cleveland, who is a pioneer of a new forehead lift. It promises for some people to cure their migraines. Welcome. Thank you so much.
Thank you very much.
I thought this guy in the white jacket there was the guy that invented or created this medication known as sumatriptan. But now I'm thinking, no way, it can't be him, when he's pretty much talking about a facelift curing something that is embedded in the human brain. I mean, come on, I can't get over how stupid this seems. But yet again, maybe I'm wrong.
And for patients who have migraine headaches in their temple area, we detach it.
Honestly, I don't see how this would work. A so-called facelift. Bloody hell. I don't think this is working for Sharon Osbourne. No offense to her. But come on, a facelift to stop migraine disease? Highly unlikely.
Small nerve that we routinely detach in the, for cosmetic surgery as well, and pull the eyebrows slightly to the sides and raise them minimally. So the patients look naturally rejuvenated and more cheerful. We take the migraine headaches away and eliminate that irritation of the trigeminal branches that cause migraine headaches.
So who's a good candidate for your procedure?
Any patient who has at least 2 serious migraine headaches.
Only 2? Huh. Well, I do know that a migraine attack can last months, and I'm not going to get into my experiences of when a migraine attack lasts so long, but only 2? And this guy claims to be able to cure it with a facelift? Yeah, whatever. And I need you to know that I, to my calculation anyway, have had about 200 migraine attacks. All I can say is, well, not guess or presume, but just trust me. In my experience, I'm not... Well, I do have a lot of knowledge, and I'm not saying anybody is wrong about this. But I don't... I don't think a so-called facelift would change something that is genetic and a neurological problem in the brain.